So for many years, I've been involved in the development of interventions, multi-level interventions, particularly in chronic disease area, and particularly for low income and minority communities. And it was partly the frustration of not really seeing those interventions that were many times successful, not seeing them actually be continued over time or be disseminated to have a broader impact. It was partly those reasons that got me into the area of implementation science. But I'm certainly glad that I have. It has really been a tremendous journey and continues to be. So now I'm going to talk to you about using implementation mapping to plan implementation strategies. I'm trying to share this screen, Sidra, and it's telling me I can't while others are sharing. So if you could stop sharing.
Okay, I stopped. You should be able to now.
Okay, great. And let me know if you can see my slides.
Yes, we can see your slides. Thank you.
Great, thank you. So I mentioned this in the overview, and the using intervention mapping for planning implementation strategies, part of the reason that it's really helpful and appropriate is because intervention mapping has been used to address multiple levels of influence in interventions, multiple levels of influence in health problems, and developing interventions to address those multiple levels. Many people wonder when we talk about the difference between intervention strategies and interventions and implementation strategies, where does one start and where does one stop? In the field of health promotion, we have many years and experience of developing multi-level interventions, where you're developing interventions not only for patients and community members, but also developing interventions for people in that individual's interpersonal environment, in organizational environments, community, and policy. So the development of interventions to try to create change at multiple levels is really a foundational principle of health promotion. When we think about implementation, implementation has also been an important area of research and development in the area of health promotion, because when you develop an intervention, whether it's for one level or multiple levels, it has to be implemented. And so thinking about the planning of implementation strategies in order to deliver multi-level interventions has always been an important part and an important practice and an important area of research in health promotion. And so as someone that this is where I'm coming from, it wasn't a big leap to start thinking about and developing approaches to planning implementation strategies. So I'm going to tell you a little bit about intervention mapping in general, very briefly, talk about implementation mapping and the tasks. Unfortunately, we have very little time, and I want to respect people's time. So I'm going to have to do this in a very short amount of time, but I will tell you that we are planning a longer training on implementation mapping specifically, so that we can have people attend and participate with their own project in mind. And it would be a project specifically about planning implementation strategies. Now, when you plan implementation strategies, you usually want to evaluate them. And I want to situate this topic within the broader topic of implementation science and implementation research. People use implementation mapping to plan implementation strategies even when they're not planning on doing research related to those implementation strategies. But we think it's really important to do research both leading up to the development of the implementation strategy and, of course, in evaluating that implementation strategy, not only to know if what you're doing is working, but also to contribute to the field about what works best when you're developing strategies. So just as a quick overview, implementation strategies are methods or techniques used to enhance the adoption, implementation, and sustainment or scale up of a program or practice, or those 7 Ps that Dr. Smith talked about. And sometimes when we talk about implementation strategies, we're talking about just one thing. And sometimes we're talking about multiple things that are blended. And most people would agree that basically you do an assessment and you try to understand what the barriers and facilitators and contextual factors that are influencing implementation, what I talked about earlier today. And then you choose or develop strategies to address these. But like Dr. Smith mentioned, and there's a nice article by Tom Waltz that I was also involved in, where we try to have people match those barriers to these lists of strategies that were available through the ERIC strategies project. And there was a lot of variability in terms of what people chose. And there are several reasons for that. And so it's not that easy. And we need a process to take a planner through understanding what the factors are that could influence implementation, to actually planning that implementation strategy. And there are several. Implementation mapping isn't the only one, but that's what I'm going to focus on today. So I already mentioned that these are some of the challenges in selecting implementation strategies, so I'm not going to cover that again. And you heard a great talk by Dr. Bro about participatory planning. And so I'm also not going to talk too much about that, except to highlight this nice article about participatory implementation science. And it's specifically about cancer prevention and control. But I think that some of the processes that they describe and the experience could be really useful for you. So as I mentioned before, there's a number of different approaches for planning implementation strategies, and intervention mapping is just one of them. Intervention mapping, as I think I mentioned in the introduction, is a systematic approach to planning multi-level interventions. It was originally developed by Kay Bartholomew and colleagues here. We're working now on our 5th edition of the textbook. There's over 1,000 publications highlighting its use, and it's been used widely in other countries as well. It's based on the precede-proceed framework, but takes it a little bit further in terms of actually the details of planning interventions. It can be used, intervention mapping has been used in a number of ways to advance dissemination and implementation research and practice. And it includes the developing interventions in a ways that will make it more likely to be adopted and implemented, what we sometimes call designing for dissemination, and that's here. In adapting interventions, and that's what we refer to it as IM Adapt, and there's this tool that can help with that. And then what I'm going to focus on right now, which is implementation mapping, which is using this process for planning strategies to increase adoption, implementation, and sustainment. And so, as I mentioned before, planning implementation was always a part of intervention mapping. It was step 5. When you're developing an intervention, a multi-level intervention, you always have to plan for its implementation. However, I realized that the field of implementation science wasn't really familiar with this, and in fact was in great need of a systematic process for how you go from the identification of barriers and facilitators of implementation to actually developing a strategy or selecting and tailoring a strategy. And so in 2019, we published this article, Implementation Mapping, which is essentially thinking about implementation science, including all of the theories and frameworks that are available in implementation science, and using intervention mapping sort of informed steps, and that's what we call implementation mapping. So For those of you who do have the textbook for intervention mapping, you'll notice that in step 5, the tasks are a little bit different than what we highlight in the paper for implementation mapping, but really they're essentially the same. The difference is that we wanted to make some of the things that were within these tasks over here on the left more explicit. And the process can be used for new programs when you're developing that intervention in the first place, and also for programs that have already been evaluated. So essentially what implementation mapping does is it helps us answer these questions during the development of implementation strategy. So it helps us answer who's involved, and what are some of the factors that might influence implementation. What is it that they would have to do in order to adopt or implement or sustain this intervention or this innovation? And implementation mapping can be used to plan adoption, to plan implementation, and to plan sustainability. And this task also helps us understand the why. Why would these individuals, decision makers, policymakers, why would they make decisions about adopting and implementing this innovation? And then tasks 2 and 3 are focused on how. How could we influence these determinants of implementation? And then, of course, task 5 is evaluating. So implementation mapping helps you walk through these different tasks. And we talked a lot about theories and frameworks. These are the ones that are most helpful when you're planning implementation. So one of the, I think, it's seemingly obvious, but I think really helpful things about the implementation mapping process is that it helps figure out what is it that we need to do before thinking about how we're going to do it. In the field of implementation science, there's been a lot of use of implementation strategies really without a very clear understanding of what does implementation actually look like. And this is something that if you're using implementation mapping, it actually sort of forces you to think about very carefully. And we call those performance objectives. But essentially, implementation mapping helps understand the determinants, the methods, and the strategies in the development of implementation strategies. And of course, we use these other frameworks and theories to guide our decisions, but implementation mapping helps provide sort of a scaffolding or process or a protocol for helping you do that. So we use stakeholder input, empirical evidence, and theories and frameworks, and implementation mapping helps us organize all of these three to develop that implementation strategy. So this is an implementation mapping logic model. And I know you've heard about the logic models from Dr. Smith. This logic model is really to help describe what goes into the development of these implementation strategies. So the logic of it goes from left to right, and it's basically saying, well, we have this evidence-based intervention, and now we want to use implementation strategies that are going to influence the determinants of program use, influence the outcomes of adoption, implementation, and maintenance, which will then lead to health and quality of life outcomes. And so while this is the logic of how it works, the planning goes from right to left, right? Where we, looking at the bottom here, understand who's involved, what do they have to do, why would they do it, and how do we influence that outcome? And of course, part of the how has to do with addressing these contextual factors here as well. These are often referred to as the form and function of implementations strategies, or also the mechanisms of implementation strategies. So unfortunately, I believe that we're out of time, but what I am going to do is we are going to be able to share these slides with you, And we're going to be working with groups from the different countries on this process. I present in these slides this Peace of Mind program, which was a program to adopt and implement an intervention, and it was an intervention to increase mammography. And so this example walks through each of the tasks of implementation mapping and provides some examples of how you have incorporated theories and frameworks and then come up with practical applications and strategies to influence change. This is a framework, a conceptual framework, where it shows that these are all the things on the left that we've used in formative work to inform the planning process, the implementation mapping process, and then how it influences the strategies that are used. Okay, so I'm really sorry that we sort of run out of time, but as you can see on these slides, there's some concrete examples. And I'll just end by saying that, when we think about how do we enhance the impact of implementation strategies, implementation mapping actually does several of these things. It helps us specify the mechanisms, improve the tracking, and conduct more work. I mentioned also that there's this forthcoming issue in Frontiers in Public Health, and that's going to help give more examples of using implementation mapping for planning implementation strategies.